Hi, I'm Rose Hayden with Hunt Regional Healthcare, and today I'm here with Dr. Babak Abbassi with Hunt Regional Medical Partners Surgical Associates. And we're talking about gallbladder disease and treatments. Dr. Abbassi, thank you.
Thank you for having me, Rose.
Oh, I'm so glad to have you.
Happy to be here.
Oh, good. And so first of all, let's just start right with it. What is the gallbladder?
So the gallbladder is an organ that's attached to the liver. It helps the body digest fat. So it helps us not only digest dietary fats, vitamins that we eat, but also the fats that, fries and things that we shouldn't be eating. It helps our body digest those.
Okay, so what is gallbladder disease?
Gallbladder disease tends to refer to one of two types of disease. One is when there's stones that form in the gallbladder that cause it to malfunction, and the second is when the gallbladder itself just doesn't work well.
Okay. What are the risk factors to gallbladder disease?
So, unfortunately, being female by itself is a risk factor. Your age is something else that can contribute to it, and being overweight. Those are the biggest risk factors we know.
Okay. What symptoms does a patient experience? How do they know they're having issues with their gallbladder?
So most patients actually don't realize that they've been having problems with their gallbladder until after surgery. And then they say, wow, I had a lot of pain that would occur after I ate and it's gone. I never knew I was having problems with my gallbladder. So it can be hard to recognize. But the biggest advice I can give patients is to pay attention to their body. Patients with gallbladder disease are going to have pain in the right upper part of the belly, and it's generally going to occur after you eat, 30 minutes to a couple of hours afterwards. And you will see that the pain occurs more often if you have a fatty meal.
Okay, that's good advice. So what diagnostic tests are used to determine if you do have gallbladder issues?
There's a lot of different tests available. It's all going to depend on what your doctor thinks is best in that setting. Most of the time, though, we start with an ultrasound of the gallbladder.
Okay. Now, what treatments really would you look at for gallbladder issues?
Unfortunately, the only treatment we know to date is surgery. When you have stones in your gallbladder or your gallbladder is not functioning, there are no medications that we can take to make it better. The only option is surgery. Thankfully, though, we're able to do the surgery laparoscopically, and that means with a small cut. So that way patients can get the surgery done and even go home from the operating room later on that day.
Oh, that's good news.
Yes.
Now, how does a person say, okay, I know it's time to visit a surgeon?
So the best thing to do is to talk to your primary care doctor. They're going to be the ones that can get the tests ordered and verify that it is your gallbladder, and then they give us a call. The second they call us, we make it our priority to get you into our clinic as quickly as possible.
Now, does that mean a referral is required?
In most cases it is, but I would talk to your primary care doctor about that.
What tips and advice do you have to avoid gallbladder disease?
Well, the biggest thing is to stay healthy, try to avoid eating really fatty meals, exercise 30 to 45 minutes every day. If you do have gallbladder stones and you notice that you're having pain in your abdomen after you eat, the best thing to do is not ignore it. Talk to your doctor, let us evaluate you because we don't want to wait until it's a serious problem.
That's great information, and really, I learned a lot. I appreciate it. So, great advice. Don't ignore your body. Talk to your primary care physician, and we might be able to help you out, right?
Certainly.
As you said, after you have surgery, you may go, why didn't I do this sooner?
That's what most patients say.
Well, thank you so much for your time today,
Thank
Dr.
you guys
Abbassi.
for
I really
having me.
appreciate
Happy
it.
to be here.
This video has been brought to you by GEUS 34. GEUS is your community-owned provider for electric, internet, cable TV, and true local programming.